Talking about measles again. Thousands of cases, outbreaks affecting communities, children hospitalized, and families asking questions about vaccination, safety, and whom they can trust. So, what happened? The headline tells us measles are rising. The cases are rising. The Project Map lens asks, why? Welcome to Pathway to Wellness, Navigating Our Journey. I am Marie Corbin, Global Health Specialist, Executive Director, retired nurse consultant, and creator of Project MAP, a global health learning library that helps people understand today's health challenges through real stories, trusted evidence, and practical action. So get your drink and let's get to work. Today, we're putting the resurgence of measles through the Project MAP lens. Our learning objectives for today: by the end of this chapter, you should be able to identify why measles has returned as an important U.S. public health concern, interpret what 26 years of measles data tells us, understand how vaccination coverage, international travel, and community immunity affect transmission. Community immunity, that's cute. Evaluate vaccine information and misinformation more critically, and identify practical steps you can take to protect yourself, your family, and your community. So let's look at the observe. What's happening? Well, sorry, y'all, I gotta stay hydrated, and you should too. Measles is not a new virus. It is one of the most contagious human diseases that we know. And although measles was eliminated from continuous transmission in the US in 2000, it was never really eliminated globally. CDC reports measles outbreaks are currently occurring in every region of the world. An unprotected traveler can acquire measles abroad and return home while infectious potentially introduce the virus into a susceptible community, and that's according to the CDC. So here's our important distinction. Elimination did not mean measles disappeared from Earth. It meant we had enough protection and enough public health capacity to stop continuous transmission here. Okay, let's look at why we need to understand. Why is measles different? And yes, I am using my notes, you guys, because I don't want to go off track. So I do have notes and I do read from them. So now let's understand the virus itself. Measles spreads through the air when infected persons breathes, coughs, or sneezes. And because it is extraordinarily contagious, relatively small gaps in community protections can matter. Now, according to the CDC, generally considers approximately 95% two-dose MMR coverage, which is measles, mumps, and rubella, necessary to suppress community transmission. Now, according to the data that I'm showing you on the screen, we see U.S. kindergarten MMR coverage from 2019 to 2020 was 95.2%. And in 2024 to 2025, that number changed to 92.5%. CDC estimates that decline left approximately 286,000 kindergartners at risk during the 24-25 school year. National averages also high communities where vaccination coverage is considerably lower. Don't worry, we're going to talk about all this. A few percentage points may sound dramatic, but with a virus this contagious, the distribution of those gaps, they do matter. A national average doesn't tell us whether one particular neighborhood, school, or religious community or social network has much lower protection. That's an important project map thing that we need to kind of let you be aware of, right? That's a project map lens that we need to look at a little more closely. Excuse me. So let's connect. So the travel connects the outbreak story, right? Now let's connect what is happening in the U.S. to what's happening around the world. Measles crosses borders very easily, as we know. The CDC says outbreaks are occurring worldwide, and unprotected travelers can acquire measles abroad and introduce it when they return home, right? So, this is why measles isn't simply an American vaccination story, it's a global health story. International travel creates the pathway. And we just did our previous video on travel health and safety questions and measures. If you want to see that video, you can see it right um, here, or that hopefully it'll pop up. But if not, just go in our playlist and you should find it under travel health. So it says this is why measles isn't simply an American vaccination story. It is a global health story. International travel creates that pathway, right? But whether an imported case becomes a larger outbreak depends heavily on what happens after the virus arrives. And that connects beautifully to the PMAP 004 Travel Smart video that I was just telling you about. Travel health isn't only about protecting ourselves while we're abroad, sometimes it's also about what we bring home. See how it all kind of connects together? Now, let's do a little evaluation here. Now, let's look at 26 years of evidence because we like data over here. So, according to the graph that I have on screen for you, this is where the story becomes especially important. Don't just look at one year's number, look at the pattern. In the post elimination era, the US experienced relatively low case counts punctuated by outbreaks, including a major 2019 resurgence. More recently, CDC surveillance shows a sharp increase beginning in 2024 and is accelerating dramatically in 2025. So, what does this graph prove? It improves that measles activity has changed substantially. But here's what it doesn't prove. A graph by itself cannot tell us one single factor caused the increase. Now, that's where responsible public health analysis begins. So, what changed, you ask? Well, according to what I have here on the screen, we have global circulation, international travel, immunity gaps, under-vaccinated communities, declining coverage, access plus trust plus vaccine confidence. CDC describes content CDC describes current U.S. measles epidemiology as being shaped by important cases, susceptible contacts, and localized pockets of under vaccination. So rather than asking who's to blame, Project Map asks what conditions allowed transmissions to occur. That is our lens. Now, let's just talk a little bit about vaccination fear because it's out there and we need to kind of review it. And we can't responsibly discuss today's measles outbreaks without talking about vaccination. but I want to approach this differently. Some parents have questions, some people are concerned about the side effects, some have encountered frightening information that they didn't know online, others may distrust healthcare institutions, and some have philosophical or religious objectives, right? And others simply haven't had access to a healthcare professional they trust enough to ask. So, questions do deserve answers, and fear deserves information. And informed healthcare decisions deserve understandable evidence, not shame. So we want to ask ourselves, with all that evaluation, what does the evidence say about the measles, mumps, and rubella, or I'll call it MMR? The MMR vaccine isn't risk free. No medication intervention is. Common reactions can include soreness, fever, or mild rash. Rare adverse reactions can also occur. Now, as a nurse, I have given this shot so many times, I don't even know how many MMRs I have given to people and have taken for myself because I was mandated to do so. And I can say that the main thing that you get when you get most vaccines is a sore arm, maybe a mild fever. That's just showing that your T cells and your immunological system is working, immune system is working. And you may get a mild rash. If you get something else out of a mild rash, then of course you're allergic and you need to go and seek um, emergency care. The CDC reports a small increased risk of the febrile seizure. Febrile means a fever, a seizure that is caused by a fever, following the MMR vaccination, but that's a small increased risk, okay? Approximately one additional event for every 3 to 4,000 vaccinated children in the relevant age group, and says, this is the CDC, and they say these seizures are not associated with long term effects. And of course, I'll leave all the links with my sources in the description box. Measles itself can measles. Now, this is the other side of the risk, right? The other side of the risk comparison. Some people are thinking measles itself can cause pneumonia, encephalitis, hospitalization, and in rare cases, death. But the CDC reported that 12% of U.S. measles cases in 2025 were hospitalized. So that's 12%, with 3 confirmed measles deaths. So that is something to note. That's something to note. We can't not ignore it, but it is something to note. Okay, and regarding that claim, many parents have heard, quote, the relationship between MMR vaccination and altruism has been extensively studied, and reviews cited by CDC have found no association between MMR vaccinations and autism spectrum disorders. Now, this is reviews cited by the CDC, Center of Disease Control. That word is deliberately precise because the CDC's current federal pages contain differing language about the broader category of infant vaccines. While it is MMR or measles, mumps, and rubella specific, evidence continues to report no association. So, let's do a project map information check, or I call them compass checks. Here's our audience skill building moment, you guys. When you encounter a frightening health claim online, don't immediately accept it, but don't immediately dismiss it either. Put it through the lens and ask these 3 questions. Who made the claim? What evidence supports it? And can I verify it independently with another reliable source? Public health doesn't require us to ask questions or to stop asking questions. Good public health teaches us how to find better answers. So, the final part of the steps of the Project Map lens is the empower. What can families actually do? Right? What can families do? Now, we're going to move forward from the information to action. If you're unsure about your own or your child's protection, check vaccination records first. Right? That's the first thing to do. Talk with trusted healthcare professionals. Ask questions about benefits and the risks. Review credible evidence. That's where the do the work comes in. Check measles recommendations before international travel. See, that's a lot, yeah, but that's the do the work. That's our do the work. We should call this section Do the Work to Become Empowered. Okay, so then when we come back down to where I was telling you all the things you need to do for your work, I need to just say if you believe you or someone in your family may have been exposed to measles and symptoms developed, contact your healthcare provider or public health department before arriving at a healthcare facility. I said before arriving. Some people show up like when they want to see what's going on. But you want to kind of call them before arriving, especially the public health department. I'm not talking about the emergency department. We're talking about the public health department because they need to be notified one way or the other. But before arriving there, please, let them know so they can advise you on what to do and how to do it so that others aren't exposed. Now, here's the Project Map challenge for the week. This week's challenge isn't about going to argue with anybody about vaccines. That's not what we're trying to do. Our challenge is much more useful, y'all. These are the things that we're going to do. You got your pencil, you got your drink. Okay, here we go. Here's your checklist. Know your measles status for yourself. That's the first thing. Know the measles status for you. Are you or are you not? Are you okay? Locate your vaccination record. Check your child's records. Okay, ask our healthcare professional whether you're considered protected. And if you're traveling internationally, review destination specific measles guidance. That's also important when you're traveling. Identify your local public health department. Remember, you had that a couple of videos ago. That was one of your go sees, as I call them, or your PMAP challenge. So, if you've done those things, um, take one vaccine claim you've encountered online and put it through our 3-question evidence test. Okay, so what's the takeaway? What's our PMAP takeaway? What's our PMAP takeaway? Well, measles didn't suddenly become a different virus. The conditions surrounding our protection have changed. International transmission does matter. Vaccination coverage, that matters. Community immunity, that matters. Access matters to care. And trust matters always. Understanding all of them helps us to see the outbreak more clearly. Thank you for joining me for another chapter of Pathway to Wellness, navigating our journey using the Project Map lens. Thank you for tolerating my sipping of water and my yapping, and my reading of my notes because I just want to make sure that I cover everything. And yes, keep asking questions, keep examining the evidence, and making informed decisions for yourself and the people you love. And until next time, see clearly, navigate wisely, and take care in caring for you.